Welcome and thank you for joining today's refresher course on preventing healthcare-associated infections with a focus on preventing Clostridioides difficile infections. This session is presented by Project Firstline Rhode Island in partnership with the CDC through the Center for Acute Infectious Disease Epidemiology at the Rhode Island Department of Health. Now, if you plan to receive CNE or CE credits, please complete the free session survey at this time. Once this course begins, you will no longer be able to access it. While you take a moment to complete that, I will introduce myself. My name is Chinamso Ademegu, and I'm an infection prevention training liaison for Project Firstline Rhode Island. I have been a nurse for more than 5 years, and although my roles have varied across specialties, infection control and prevention have always shaped my practice. Now, please introduce yourselves in the chat and share your name, your role, and where you work. I'd like to acknowledge the Project Firstline team supporting today's session. With us is Dr. Kearney, our consulting medical director, who I will now invite to come on camera and introduce herself to you all.
Good afternoon, everyone. Super excited to be presenting this topic to you today. We'll all be in the background, so if there's any questions, please let us know.
Thank you, Dr. Kearney. We are also joined by Abby Anderson, our project assistant, who will help us to manage the chat and offer support throughout the session. Also, a special thank you to the rest of the team working behind the scenes for their support. Now, before we begin the content, let's review a few important reminders regarding continuing education requirements. Here are the credit requirements for CNE, CE, EMS, dental IPC, and general certificates of training. This is a 60-minute session approved for 1 contact hour. This nursing continuing professional development activity is approved by the Northeast Multi-State Division Education Unit, an accredited approver by the American Nurses Credentialing Centers Commission on Accreditation. For CNE participants, all 4 steps of the credit process are required, including the post-session quiz. This quiz link will be emailed to you tomorrow. For EMS, dental IPC, and general certificates, only steps 1 and 3 are required. This includes completing the pre-session survey, attending this live session, and completing the post-session survey. You will receive that link by email as well. So now that we've reviewed CE requirements, let's go over a few housekeeping items before we begin. For those attending for the first time, welcome. For those returning, we're happy to have you back. It is always great to have you all with us. A few housekeeping rules. Everyone is muted at this time. The Q&A box is located at the bottom of your screen. We will address your questions towards the end of the session. The chat is open if you'd like to share experiences and connect with others in this session. If you'd like to join our email list, please drop your email in the chat and we'll make sure to include you in our future updates. Now that we have covered these important details, let's take a look at our agendas for today. Here is our agenda for this refresher course. We will begin by defining what C. diff is and review key data that it helps explain its impact on public health. From there, we'll explore how C. diff affects patients and healthcare systems. Next, we'll walk through infection prevention and control practices that work in real life and real-world care settings. After that, we'll pause for reflection and discussion, followed by key takeaways that highlight the most important points from today's session. At the end, I'll share up announcements and we'll open the floor for questions and feedback. Now, having an agenda is helpful, but our learning objectives will help guide us in what we should be able to do by the end of the session. Let's review them together. By the end of today's session, you'll be able to define C. diff and identify who is most at risk for infection. You'll be able to describe how recognizing where germs live supports illness prevention. You will explain how C. diff spreads through various transmission pathways and how those pathways can be blocked through effective infection control practices. You will apply infection prevention actions that stop the spread of C. diff. Use this knowledge to strengthen infection prevention in your own workplaces and encourage others to maintain high standards for infection control. Finally, you will walk through a real-life scenario to practice applying those skills in context. Let's review a few key terms that we'll see throughout this session. Here are some key terms you will hear throughout today's session. These include antimicrobial stewardship, colonization, spores, and healthcare-associated infections. Each of these play a role in understanding how C. diff spreads and how we can prevent it. Now, you don't need to memorize these terms now. As we continue, we will revisit each one in context and discuss why they matter. With those terms in mind, let's look at guiding resources that shape our response to C. diff here in Rhode Island. The Rhode Island C. diff playbook, developed by the Rhode Island Department of Health, offers an evidence-based approach to reducing C. diff infections in healthcare and long-term care. It promotes statewide consistency, early detection, and strong infection prevention practices, including hand hygiene, PPE use, environmental cleaning with EPA List K products, and antimicrobial stewardship. The playbook also emphasizes staff education, rapid testing, isolation of symptomatic patients, and coordinated data tracking to reduce illness, prevent death, and support high-quality care. Abby will post the link in the chat if you'd like to review it later. So now that we understand the framework guiding C. diff prevention statewide, let's look at some data that helps explain why C. diff remains such a public health concern. Now, in the next few slides, we'll look at important data points and facts that guide us and give us context to why C. diff is such a significant and ongoing challenge across healthcare settings. These numbers help us understand where the risks are and why consistent prevention strategies matter so much. First, let's take a closer look at C. diff itself. Clostridioides difficile, or commonly known as C. diff, the tongue twister, is a bacterium that causes severe watery diarrhea and inflammation of the colon, known as colitis. You may also see the older name Clostridium difficile in some materials. Some key facts to keep in mind. C. diff is a spore-forming gram-positive organism that can cause serious and sometimes life-threatening disease. It is the most common cause of antibiotic-associated diarrhea. C. diff can be acquired in healthcare settings and in the community. It spreads easily and is challenging to treat due to its ability to form spores. Those spores are what makes C. diff especially persistent. All right, let's take a closer look at how these spores behave and why they make C. diff so difficult to eliminate. When C. diff germs are outside the body, they transform into spores. Those spores have a thick protective coating that allows them to survive for long periods on surfaces and equipment. They are highly resistant to environmental stress and can be transferred from surfaces, equipments, or hands to another person through indirect transmission. Once swallowed, spores reactivate in the gut and start causing illness. Their durability makes them a major challenge in infection prevention. This brings us to our first poll to check our knowledge. How long do you think C. diff spores can survive on surfaces? Now feel free to participate in the poll and choose the correct answer in front of your screen. How long do you think C. diff spores can survive on surfaces? If you selected C, up to 5 months, you're correct. C. diff spores can be shed through the environment by symptomatic and asymptomatic people and can survive for up to 5 months, which is one reason why they spread so easily. Due to their resistance to most hospital disinfectants and standard cleaning methods, they are incredibly tough. This survival ability helps us understand why C. diff remains such a significant public health threat. C. diff is one of many healthcare-associated infections, or HAIs. These are infections that patients acquire while receiving medical care. Preventing HAIs is one of the most important responsibilities we share across all healthcare settings. To see the scope of this problem, let's look at some national data. Healthcare-associated C. diff cases have declined slightly, but community-associated cases have not, which means the overall burden remains high. C. diff spreads quickly and contributes to outbreaks that are difficult and expensive to control. National estimates suggest more than $1 billion in preventable costs each year. This raises an important question on how do we measure whether things are getting better? Well, that's where CDC's surveillance system comes in. The CDC's Emerging Infections Program tracks C. diff infections nationally. According to a 2022 data, 61% of individuals diagnosed had taken antibiotics in the 12 weeks prior. Most exposures occurred in healthcare settings, including hospitals and long-term care. Nearly half of all of these cases occurred among non-Hispanic Caucasian patients. These findings show us that C. diff infections continue to be a significant public health concern. Now, beyond the numbers, there are also myths that can interfere with prevention efforts. We will review 3 myths and we'll also review 3 corresponding facts. The first myth states that alcohol-based sanitizer and soap kill C. diff spores. But the fact is that while the CDC indicates a preference for alcohol-based hand sanitizer due to increased hand hygiene compliance and the result of not enough studies showing a clear prevention benefit for soap and water, neither actually kill spores. Alcohol-based hand sanitizer do not remove the spores, but while soap and water can help to remove some spores from your hands, it does not remove them all. This is why gloves and proper PPE are essential. The second myth states that C. diff mainly occurs in hospitals, but the fact states that nearly 45% of cases actually occurs in the community. The third myth states that nothing can be done to prevent C. diff, but the fact is that many cases can be prevented with evidence-based infection control strategies. But although not every case can be avoided, we can significantly reduce the risk. Now, with these misconceptions now clarified, we can now focus on what actually prevents C. diff. Prevention starts with recognizing who is most vulnerable and understanding the routes through which C. diff spreads. Early testing and timely treatment reduces the chances of further transmission. Because individuals who've had C. diff are more likely to get it again, communication and coordinated follow-ups are essential. I will discuss these with you in more detail in the coming slides. With that foundation, let's look at risk factors. Over the next few slides, we'll review who is most at risk and how C. diff presents clinically. When we recognize vulnerability early, we can act quickly and prevent complications. We'll start with the strongest risk factor, antibiotic use. Antibiotics are a primary contributor to C. diff infections because they disrupt normal gut flora. Other major risk factors include age greater than 65, immune suppression, prior C. diff infection, recent healthcare exposure, and recent gastrointestinal procedures. Okay, now let's take a look at the clinical presentation of C. diff infection. Signs and symptoms of C. diff range from mild to life-threatening. These include watery diarrhea, abdominal pain, nausea, loss of appetite, and low-grade fever. Severe cases can lead to colitis or toxic megacolon and cause bowel perforation or even death. This is why early recognition and prompt testing matter. To support this, the CDC provides simple clinical tools that help providers identify risk quickly. Here's one example. This CDC tool supports clinical decision-making when evaluating a patient for C. diff. It highlights risk factors and helps guide safe antibiotic prescribing. It can be displayed in your break rooms or nursing stations, and it is also included in today's resource packet. Abby will share the link in the chat. But speaking of tools, another great resource is this one-page fact sheet. This infographic offers a quick overview of preventative measures, who is at risk, how C. diff spreads, and the steps we can all take to stop transmission. It is a great one-page reference you can use in any care setting. Abby will paste the link in the chat, and this resource is downloadable and printable. Okay, now let's take a look at how C. diff spreads and how C. diff makes people sick. When prevention measures aren't followed, vulnerable people go unidentified. And when there's a limited understanding of how C. diff spreads, transmission continues. And this is how people get sick. In this section, we'll explore how exposure turns into illness and impacts spread using 5 key elements. These 5 key elements are important in our understanding of how infection spreads. Let's go over each one. The reservoir is where germs live. The pathway is how they leave that reservoir. The new person is who the germ moves to. Defenses relates to how well that person can resist infection. And survival, that just refers to how long an organism can persist in the environment. For C. diff, the reservoir includes the gut and contaminated surfaces. Spores spread through the fecal to oral route. A new person becomes exposed to those spores, contaminated hands or surfaces, and then enter the mouth. If that individual has weakened defenses, especially due to antibiotic or illness, infection becomes more likely. And because spores can survive for months, the opportunity for spread continues. Okay, let's pause for a moment. Where might C. diff spores live in your facility? Please feel free to put your answers in the chat. Where might spores survive or live in your facility? Okay, someone said on the hands, on surfaces, toilets, sinks, bedside tables, tray tables. These are all great answers. Thank you for these responses. These examples highlight how easily spores linger. Let's look more directly at how transmission happens in day-to-day care. Transmission happens in two major ways. The first is direct transmission through hands of healthcare workers. The second is indirect transmission through contaminated, high-touch surfaces and shared equipment. Examples include commodes, bed rails, pulse socks, bathtubs, handrails, bedside tables, and rectal thermometers. These are all potential reservoirs when not properly cleaned, reinforcing why hand hygiene, proper PPE use, and consistent, thorough cleaning are essential. To bring this to life, let's walk through a quick scenario. Imagine this scenario. You are a healthcare worker handling soiled linen from a patient with suspected C. diff. You remove your gloves, but do not perform hand hygiene. Your hands are now contaminated. You touch the bed rail and the IV pump. Later that day, your patient touches the same bed rail and eats without washing their hands. Spores have now entered the patient's body. Because the bed rails were not disinfected and the patient's defenses were weak, infection developed. This single moment includes every one of the 5 elements we discussed: reservoir, pathway, new person, defenses, and germ survival. Now think about similar opportunities for spread that you've seen in your own facilities. While you reflect on that question, let's check your understanding of actions that help to stop transmission with another poll. The question is, what can healthcare personnel do to prevent the spread of C. diff? Okay. The correct answer is E, all of the above. Good job, everyone. All of these actions really do work together to prevent infection. Now let's get into the depths of these infection prevention control actions. In this section, we'll translate everything we've learned into action. We'll start by walking through 3 main areas: standard precautions, C. diff specific measures, and finally communication and follow-up to prevent reoccurrence. Starting with standard precaution, which should be applied to every patient every time. Standard precautions include hand hygiene before and after patient contact, PPE based on risk, respiratory to hygiene, safe injection practices, cleaning, disinfecting of equipment and surfaces, and proper handling of laundry and waste. These practices form the baseline for safe care across all healthcare settings. Now, let's layer all the 4 guidelines we follow specifically when caring for someone with C. diff. Before we get into the specifics of how these precautions are applied, this slide shows the 4 pillars of C. diff prevention. We'll walk step by step through each of these pillars and how they all work together. The 4 key guidelines are patient isolation, hand hygiene, contact precautions, and cleaning and disinfection. For patient isolation, we'll reserve that when we get to the section on contact precautions. But for now, let's watch the CDC Clean Hands Count video.
We all know about the growing threat of antimicrobial resistance and have seen the headlines about superbugs and nightmare bacteria. Unfortunately, this threat is very real. Now more than ever, it's critical that we work together to contain these drug-resistant pathogens and the infections they cause. Keeping our hands clean is one of the most important ways to prevent the spread of infections. Every time we enter the patient zone, we can get dangerous germs on our hands and spread them to ourselves or to other patients. Sometimes we don't clean our hands as often as we should, not because we mean to do harm, but because it's a daunting task. Some of us might have to do it 100 times a day. It takes dedication, mindfulness, and time. Our patients' lives depend on it. Let's applaud the efforts and improvements we've already made. Increases in hand hygiene adherence have led to decreases in healthcare-associated infections. At the same time, we know there is still room for improvement. We can all do better. Our clean hands count. Now, more than ever.
The hands of healthcare workers are one of the main ways that C. diff spreads. Even after glove removal, spores can still remain on the hand. Although it's preferred, because alcohol-based hand sanitizer does not kill the spores, washing with soap and water only on visibly soiled hand is the best option. Next, we're going to connect that video to CDC-specific hand hygiene recommendations. The CDC recommends using alcohol-based sanitizer for routine care because it improves compliance and reduces other infections. The CDC recommends the use of soap and water when hands are visibly soiled or during C. diff outbreaks. It is also recommended that gloves and gowns should always be worn for every room entry and care. An important thing to note is that the removal of sanitizer stations does not actually reduce C. diff transmission. Rather, it reduces overall hand hygiene compliance. This leads to a question that often comes up in practice. What do you think about using alcohol-based sanitizer in areas with C. diff? Should we remove alcohol-based hand sanitizer from areas where C. diff is present? Please put your answers in the chat. All right. We are all in agreement. The answer is no. You should not remove it. Alcohol-based hand sanitizer remains essential at the point of care because it's quick and easy, so staff use it more often. It kills most other pathogens that cause serious infections, and it kills the non-spore form of C. diff, which can still spread disease. But remember, sinks aren't always nearby, and exclusive reliance on soap and water would lower compliance. Now, does promoting sanitizer reduce the importance of soap and water? Please put your answers in the chat. Great. Again, the answer is no. Both have their place depending on the situation. Now let's move into another essential measure, contact precautions. Question for you all. When do you think we should initiate contact precautions for suspected or confirmed C. diff? Please feel free to put your answers in the chat. Okay, someone said immediately. Suspected, as soon as suspected. Okay. Well, contact precautions should begin when a patient has 3 or more unformed stools in 24 hours. Private rooms are preferred. Cohorting may be considered only with another confirmed C. diff patient after risk assessment. But please follow your facility's policies for discontinuation of precautions. Also remember, when providing care, C. diff patients may still shed spores even after their symptoms improve. So please protect yourself and others at all times. Now, on a more practical level, let's look at how these precautions appear during day-to-day care. Staff should wear gowns and gloves before entering the patient's room. Use dedicated equipment. If equipment must be shared, clean it immediately with an EPA List K agent and communicate precaution status clearly to all staff. In discontinuing the precautions, generally, the precautions should be discontinued only once diarrhea has resolved, defined as fewer than 3 unformed stools in a 24-hour period. However, some experts recommend continuing precautions for 48 hours after diarrhea resolves due to continued shedding and environmental contamination. You may also consider maintaining precautions through the completion of C. diff infection antibiotic therapy. In facilities with high rates of C. diff infections, continuing until discharge may be recommended. For residents who are incontinent or require substantial assistance with daily activities, extended precautions are also recommended. Finally, a key thing to remember here is colonization is common. Colonized patients test positive but have no symptoms, while infected patients will have symptoms and will test positive. All right, let's test our knowledge with a poll question on a common isolation question. The question is, when can a patient with C. diff be removed from contact precautions? Please put your answers in the chat. The correct answer is D. All right, I got ahead of myself there. The correct answer is D. Well, the best answer is D. But to be more specific, the CDC recommends contact precautions until at least 48 hours after diarrhea has resolved and the infection is fully controlled. But your facility may extend that longer, so please follow your facility's policy on discontinuation. To prevent unnecessary testing or mislabeling, let's review testing guidance. Testing should begin with clinical assessment because not all diarrhea warrants a C. diff test. It's important to rule out laxatives. Only test unformed stool. Do not retest to confirm cure because labs may reject inappropriate samples. It's important that facilities encourage nurse-driven isolation protocols, use forcital disinfectants, and also dedicated equipment and provide daily bathing and communicate C. diff status clearly during transfers. Now let's go to cleaning and disinfection. When cleaning, always use an EPA list K sporicidal product because not all disinfectants kill C. diff spores, so always read the label carefully. Perform daily cleaning of rooms with confirmed or suspected C. diff using those sporicidal agents. After transfer or discharge, perform terminal cleaning to eliminate residual spores. Focus on high-touch areas like bed rails, call lights, toilets, and shared equipment such as wheelchairs, blood pressure cuffs, and gurneys. Follow a formal cleaning sequence, starting with cleaner areas and moving towards dirtier ones, cleaning low-touch before high-touch surfaces, and cleaning patient areas before bathrooms. This reduces cross-contamination and keeps the environment safe for the next resident. Now, to help us identify which cleaning products meet those standards, the EPA maintains a special list known as List K. We'll review that next. The EPA List K identifies antimicrobial products proven effective against C. diff spores. Each product has undergone testing that confirms their ability to kill C. diff spores, but effectiveness depends on how they're used. Always follow the manufacturer's directions for dilution, contact time, and drying. Verify that the product label specifically mentions C. diff and includes use instructions for healthcare settings. Look for the EPA registration number on the label. It usually appears as EPA Reg NO, followed by a set of numbers. You can enter that number into the EPA's List K search to verify compliance. Now remember, being on List K doesn't mean endorsement. It simply confirms a product meets testing requirements. Abby will drop the EPA List K link in the chat for quick access. So now that we've talked about how to clean and disinfect safely, let's talk about another key prevention strategy, antimicrobial stewardship. Each year, the U.S. reports over 2.8 million antimicrobial resistant infections and more than 35,000 deaths associated with them. That's why antimicrobial stewardship is one of the CDC's core infection prevention strategies. Effective stewardship means using antibiotics only when needed, choosing the right drug, dose, and duration, and coordinating care between inpatient and outpatient settings to avoid unnecessary overlap. This approach not only helps prevent C. diff, but also improves patient safety and reduced antibiotic resistance. Lastly, we will look at why stewardship is so critical and the impact it has across healthcare before going into our key takeaways from this session. Okay, so why is antimicrobial stewardship important? It's important because C. diff infections are strongly associated with prior antibiotic use. To reduce CDI, we must reduce unnecessary or inappropriate prescribing. Antimicrobial stewardship improves patient outcomes, reduces microbial resistance, and decreases the spread of multi-drug resistant organisms. Antibiotics have transformed modern medicine from treating one lethal infection to enabling cancer chemotherapy and organ transplantation. But about 30% of antibiotic use in acute care hospitals is unnecessary. Roughly 1 in 5 hospitalized patients who receive antibiotics experience an adverse effect. That's risk without benefit. Stewardship programs allow us to review antibiotics in patients with a new CDI diagnosis, identify opportunities to stop unnecessary antibiotics, and make sure that patients are on guideline-directed therapy. This not only improves treatment response, but it also reduces reoccurrence. Okay, now for our key takeaways. The big point here to remember is that C. diff is an urgent public health threat, and it is preventable. Healthcare-associated infections can be significantly reduced or eliminated when core prevention practices are followed. Prevention begins with identifying who is most at risk. If infection occurs, consistent infection prevention and control practices can stop the spread. And finally, strategies like contact precautions and antimicrobial stewardship are essential in reducing CDI rates. Now, as we wrap up, remember every action from hand hygiene to antibiotic review make a measurable difference in safety practices. Let's finish by reviewing some helpful resources and upcoming Project Firstline training opportunities. An important reminder, if you didn't provide your email earlier in the chat, please enter it now in the chat to be added to our distribution list of upcoming trainings. You can also email Project Firstline directly if you have any questions. You can also click on our live events through our website. Abby will post that in the chat as well. You can also follow Project Firstline on social media. Follow us on YouTube, Twitter, Facebook, Instagram, and LinkedIn. We have 2 upcoming trainings. The first I'd like to bring to your attention is happening on Monday, December 8th. This session will be presented by Allison Thurber on standard precaution and hand hygiene. The second will be presented by Kelly Cotito Rivera on part 2 of CD EVS Deep Dive in Spanish. To register for these trainings, you can click on the registration link we put for you in the chat. Here are resources. Here are the resources for our session today. Now, to receive credit, CNE participants must complete all 4 steps, including the post-session quiz, which will be emailed to you tomorrow. To be clear, this quiz is only required for CNE participants. For EMS, dental IPC, and certificates of training, only steps 1 to 3 are required. The post-session survey will be emailed to you tomorrow also. Once you complete the requirements, a certificate of training will be emailed to you in PDF on November 20th. This afternoon, the post-training resources in this PowerPoint will be emailed to everyone who attended today's session. Thank you all for attending and have a lovely remainder of the day. Thank you. Thank you.